Hey everybody, just wanted to get on here and give a quick update on what's happening with me. So 3 days ago I had the surgery. So I had the surgery on Tuesday. And so now I'm at home just recovering, resting, continuing to take the pain meds. Surprisingly, I'm not in a lot of pain. I am just mostly sore. I mean, sometimes I have pain, but it's usually when the pain medicine has worn off. But otherwise, it's just basically just soreness and like tenderness and like it kind of itches around the area where the catheter was placed. There is a bit of bleeding on the, I don't know why I make that face, bleeding. There is a bit of bleeding in the catheter area. And so I was instructed by my PD nurse, which is my dialysis nurse, to just add gauze and tape on top of that area where it's bleeding. No, I'm not supposed to like take the bandage off and change it right now because she's going to teach me how to redress my wound. So basically, let me just kind of break down what happened. So basically, Tuesday, I went into surgery. They prepped me for surgery, did the surgery, got out, and then I was in the recovery room where I was waking up. They're checking my blood pressure, making sure I'm waking up fine, making sure there's nothing wrong. They put a tube down my throat during the surgery. Which I think they do that for all surgeries. So my throat is a little bit sore. Actually, I'm not even gonna joke. It's a lot of bit sore. Right now, it's actually okay. But so I had like a really, really sore throat when I woke up in recovery. And so anyway, so that happened. I was there from about 8 o'clock and I discharged at about 1:30. And so I was there for quite a bit of time, but it was a straightforward surgery. They didn't have to do anything like remove a hernia or anything extra. So it was pretty straightforward. They just placed the catheter and patched me back up. And so after that, got my pain medicine, and I was just discharged. Got back home, took pain medicine, and just slept basically the rest of the day. I got up and ate, of course. Then the next morning, I had to go to the dialysis center. And so if some of you guys don't know, some of you guys don't know, if a dialysis patient doesn't get their dialysis from like their treatment from the hospital, it's a dialysis center. And so basically anything related to dialysis necessarily, or like, anything to do with me getting dialysis, people checking on me, how my progress is doing, it would be through the dialysis center. And so I went there so my nurse could change my bandage and check to make sure that everything is okay. She flushed the catheter just to make sure that it works properly. And I believe they use some type of liquid. I think it's just sugar water. And so they flushed it with that to make sure it was working, and it works. And I wasn't expecting it to hurt, but it did. So when she flushed, when she put the liquid in, and she puts it in, I think she said a couple of, I don't know how many she put, but she didn't put all the liquid up at once. It was like 1,500 milligrams, I think, something around there. Anyway, she didn't put it all in at once. She put it in like, I think she took like a minute to put it in and a minute to flush, a minute to put it in, a minute to flush. But so when she put it in, it feels like, if you're a woman, then you know what I'm talking about. It feels like a period cramp, a lot of pressure and a sharp pain all at the same time. And so it was like, ugh. And then it kind of feels like you have to go to the bathroom, like number two. And so it was like, okay. So I wasn't expecting it to hurt. I'm just thinking like it's gonna feel like, like when you put an IV in, you can feel like the cold liquid go through your veins. I'm thinking it's gonna be similar to that, not thinking it's gonna hurt, but it did. And so I was like, oh, it hurts. And then she's like, oh, okay, yeah, it's fine. It hurts the first, time because your body, it's just a new thing that's happening. And I'm like, oh, okay. So I was surprised about that. So anyway, so she flushed it. It works well, so that's good. She redressed it, so she changed the bandage, cleaned it, changed the bandage. The thing with this, like changing or anything to do with this area, the catheter area, giving myself dialysis, this whole process, they put really big on. They are really big on sterilization. Like it's almost to the point like soak your hands in bleach for 2 hours, then redress yourself. I'm just joking. But I'm just saying they really are like, you have to be super clean. Everything has to be clean. This has to be super clean, 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 clean. I'm just like, Lord, help, help, help. So even though I'm a fairly clean person, I just feel like even my cleanness is not even good enough for this. So y'all got to pray for me. But anyway, so she was just telling me that it has to be clean. Every step just has to be clean. They're very meticulous on how the dressings change, how you clean the catheter. And so I'm just like, Lord, I'm waiting for the day where it becomes second nature. So y'all keep me in your prayers. I'm gonna post a picture on my page of what the area looks like, so you guys can see if you guys are curious. But I'm doing fine. Like I said, I'm mostly just resting because of the meds. I am still walking pretty slow, but I am getting around and doing things that I need to do around the house. So just wanted to, like I said, give you guys a quick update. The next step is, excuse me, Lord Jesus, I just drank something. So I had the surgery Tuesday, then I visited my dialysis center on Wednesday. My next visit to the dialysis center is Tuesday of next week. And then the week after that, so the second week of June, is when I will start my dialysis treatment. And so they want to make sure that my wound is recovered and healed properly before they start the dialysis. I think some people don't even have the luxury to do that. I think some people's levels are so bad that they have to like get the surgery and then start dialysis immediately, I think. And so I'm lucky to, be at a place where, like I have the time to at least recover from that and then get on dialysis. Because I can't imagine like all that pain from the surgery and then going through something new like dialysis. I can't imagine that. So that's the plan. So the next step is just one more appointment with the dialysis center. They're going to flush it, change my bandage, go over some details. And then the following week we'll start dialysis. So that's pretty much it. That is my life right now. Continue to pray for me as I go through this. So far it's going well. I have a really good support team. And so just very thankful. Thank you for everybody that's praying for me. And here we go.